Module 5, Monitoring Model Drift. Module Overview. Detect when models lose accuracy in production. This is MLOps' most critical function. Learning objectives. By the end of this module, you will implement monitoring dashboards, detect data drift, concept drift, and prediction drift, set alert thresholds, investigate root causes, design monitoring architecture. Lesson 5.1, What to monitor. Metric 1, Model accuracy, primary, compare predictions to actual outcomes. Daily accuracy should remain plus or minus 5% of baseline. Accuracy by segment, check if model biased toward certain groups. Alert, if accuracy drops greater than 5% for 3+ days, investigate. Example dashboard. Overall accuracy, 86%, baseline, 88%, warning sign #alert. By age group. 18 to 25, 82%, baseline, 84%, degradation here. 26 to 40, 88%, baseline, 90%. 40 plus, 87%, baseline, 88%. By region. North, 86%, baseline, 88%. South, 84%, baseline, 86%, bigger degradation. West, 89%, baseline, 88%. This reveals 18 to 25 age group in South region showing drift. Target retraining. Metric 2, Feature distributions, data drift, compare feature distributions, training versus current production. Method, Population Stability Index, PSI. PSI equals sigma, percent current, percent baseline, times ln, percent current, percent baseline. PSI less than 0.1, no drift, stable. PSI 0.1 to 0.25, small drift, monitor. PSI greater than 0.25, significant drift, investigate. Example. Feature, age. Training, baseline mean 38, STD 12. Current, production mean 42, STD 11. PSI, 0.18 monitor, not yet critical. Metric 3, Prediction distribution monitor range and variance of predictions. Example, churn model. Training, 20% churn predictions, true churn rate, 18%. Current, 8% churn predictions, true churn rate, 16%. Model is underpredicting churn drift detected. Action, investigate why, may need retraining. Lesson 5.2, Monitoring architecture. Real-time monitoring pipeline. Production predictions. Prediction logger, store predictions, features, actuals. Drift detection engine, runs hourly. Compare daily accuracy versus baseline. Calculate PSI for each feature. Check prediction distribution variance. Output, drift signals. Alert service. Accuracy alert, 86%, baseline 88%. Drift alert, age PSI equals 0.28, significant. Notify, data ENG, MLENG, product manager. Grafana Datadog dashboard. Display all metrics, trends, anomalies. Lesson 5.3, Alert thresholds. Threshold settings, company dependent. Alert threshold action. Accuracy 0.25 alert data team, check for issues. Prediction drift variance greater than 50% increase alert ML team. Latency, P99, greater than 500 milliseconds scale infrastructure. Error rate greater than 2% immediate rollback. Fairness, demographic parity, greater than 10% disparity alert, review for bias. Tuning, thresholds too tight equals false alarms, ignored. Too loose equals miss real problems. Case Study 5, Healthcare Diagnosis Model Drift. Company, MediAI, healthcare startup. Model, diagnostic model predicting disease, cancer, diabetes, etc., based on lab results. Problem, model trained on 2021 lab data. By 2024, lab testing processes changed, new equipment, different calibration. Model accuracy dropped from 94% to 81%. Old approach, no monitoring. 6 months, accuracy degradation unnoticed. Doctors relied on model predictions that were now inaccurate. Risk, misdiagnosis, patient harm. Finally discovered via compliance audit. Cost, legal liability, regulatory fines, loss of trust. New approach, with monitoring. Daily accuracy monitoring, overnight batch process. Alert, accuracy dropped to 88%, baseline 94%. Root cause investigation, lab equipment calibration changed February 2024. Feature drift detected, lab value distributions shifted. Action, retrain with recent data reflecting new equipment. Recovery, accuracy returned to 94%. Timeline, 2 days versus 6 months to discovery. Impact, prevention of potential misdiagnosis. Maintained regulatory compliance. Preserved patient trust. Cost of monitoring, $50,000 per year. Cost prevented, $5 million plus, lawsuits, recalls, fines. Module 5 Key Takeaways. Monitor accuracy daily. Compare predictions to actual outcomes, alert on 5% plus drop. Detect data drift with PSI. Feature distributions change before accuracy drops. Monitor by segment. Drift may affect one cohort, age, region, before overall accuracy. Set realistic alert thresholds. Too tight equals ignored, too loose equals missed problems. Monitoring is 24/7. Batch models check overnight, real-time models check continuously. Real impact, MediAI detected drift in 2 days versus 6 months, prevented patient harm plus regulatory fines.